Welcome to The Pursuit of Health, the podcast of Americans for Free Choice in Medicine. I'm your host, Rainer Schur. Joining us on the show today is Lin Zinser. Lin, thank you for joining us.
Thank you for having me. I'm happy to be here.
So Lin, we're having you on today to talk about health advocacy at the state level. Now, you yourself were involved in challenging the 208 Commission in Colorado. Could you tell us a little bit more about that and how you got into health advocacy?
Sure. This occurred several years ago, and I went to a meeting in the fall of 2006, and the meeting was about healthcare reform. And I don't remember even why I went to the meeting, but at the meeting, I learned that the legislature had set up a commission called the 208 Commission, and they were wanting to introduce either mandatory health insurance for everyone in Colorado or at least mandated policies for Colorado. And I walked away from the meeting, and that really upset me. And partly because I was self-employed at the time, I actually was still trying to figure out what I wanted. I quit my law practice that I'd been involved in, and I was trying to figure out what I wanted to do next and was doing a number of different things. But I had my own health policy, insurance policy, and I didn't want to lose that. And I had friends that were doctors, and one particular doctor, Paul Shea, and I didn't want to lose him to another state because I was afraid that he would leave Colorado if this went into place. And I didn't know what to do. And so I went home and I thought about this, and I read some articles, and I had friends. And I pulled together a meeting on a Sunday and brought together a group of friends that some of them were in medicine and some of them were not. And they were part of a group that I had that studied Ayn Rand's ideas. And so we talked about this. I told them what was going on. I told them that I wanted to fight this bill. And I didn't know how to do it, but I wanted to know if anybody was interested in helping me. And several people were interested in helping go forward. So at this meeting, I had already decided that I wanted to start my own group to fight this because I really wanted to do it on a principled basis. I wanted to go completely free market. That was very important to me. And I wanted to do it in a way that I would not be under anybody else's constraints. And so we talked about what we could do. We created the name of an organization at that time, which was Freedom and Individual Rights in Medicine. And we had an acronym FIRM for that. And that was important to us, that it was both about freedom in medicine and individual rights in medicine. And one of the people there said that she could create the website for us, Diana Shea, and she did. And the website was westandfirm.org. And that website still exists today. It's not active, but it does exist. And you can see a number of the articles and things that I'm going to talk about today on that website. Anyway, we did that, and we didn't know how to do letters to the editor. We didn't know anything. And so somebody said that they would investigate and see if they could find all the names and addresses of newspapers to write to in the state. And I knew that there were meetings coming up, and I said I would attend the first meeting of this commission and to see what was going to happen. And that was really the beginning of it. That's really the beginning. And there were about 7 people that indicated they were interested, a nurse, a couple of people who did kind of independent journalism, and the doctor. And that's the beginning of an effort that we did, and we didn't know anything about how long it would take or anything at that point. I did a lot of research in the next 2 or 3 weeks and found out that the first meeting would be in January of 2007. They would meet for a year, and in January of 2008, they would present it to the state legislature for a bill, their recommendation for a bill, and then that would be the bill that the state legislature would decide on. And I learned this. I didn't know any of this at the time, but state legislatures only meet, most of them only for a set period of time, mostly a few months in the spring. Generally, they start in January and end sometime in April, May, June. There's a couple of states, I guess, that go year round, but most of them meet on a very limited basis. So we had this great window, which I think turned out to be a really positive aspect of it. We figured that if we could get it defeated that first time around, that would be the end of it, and we wouldn't have to worry too much beyond that. So what we were looking at was essentially nothing more than about an 18-month window because the legislature met in the closed session, usually in May um, of the year. So it would be from January to May that it would be at the legislature. And so if we could influence the bill and or eventually stop it at the legislative level, then that would be it. So we only had to be doing this for that limited period of time. And that, I think, ended up being a big factor in our success. The legislature voted it down 96% in May of 2008. So we were successful in this.
So before going into how you got that amazing achievement and advocating for not adopting those bills, could you just say a little bit more for our listener what this bill represented to you and the people that you were advocating for? I mean, you said that you were on private health insurance, you had people in healthcare that you cared about, you were afraid that they were going to leave the state. Can you just say a little bit more about why this was a threat to your values and why you were afraid that they were going to leave, what it would do to them if they would have stayed under such a system?
So for me personally, I was single at the time and I was healthy. And I had a policy where it was basically just an excess insurance policy. I paid for all my medical bills at a low level, and I only called in that policy, used that policy for anything like a hospitalization. So I was paying, I think it was about $50 a month or something at the time for this policy. And that would have done away with that policy because it would have required, the policy would have required everybody to have basic insurance on everything.
Right. So what you had was a form of what's now called a catastrophic health insurance,
Right.
which
Yes,
is
that's
what
exactly right. Thank you.
real insurance is supposed to be. And that would have been taken away because all insurance policies would be required to cover routine medical care.
Yes.
Well, it defeats the whole model of insurance and how insurance is supposed to bring expensive healthcare procedures within the reach of everyone. That was being threatened by
Right.
changes. And from talking to doctors like Paul Shea and others, what did they tell you about what it would mean for them on the provider side?
So, and you see this today in going to doctors' offices. It means that everybody then has access to the doctors at the same price, and doctors can't discriminate by choosing to do a particular kind of practice. I mean, and obviously they choose their own medical specialty, but they can't decide whether they want to treat more common ailments and be open in a more general way, or they want to just specialize in particular things. They have to take anybody that has the coverage that the government mandates. And so it means that you have to wait. It's harder to get in to see doctors. It's harder to get access. I would have had to pay more for insurance that I didn't really want or need because I'm essentially paying for care that I wouldn't necessarily need. It also meant that they had more forms to fill out. They are not only accountable to me, and they couldn't take cash from me. They could not discriminate and take less money from some people if they felt that they wanted to be generous to somebody who didn't have money. They couldn't ask more for people, something different. They had to take the same amount of money, and the insurance company, usually it's done with insurance companies, and being involved and forced to provide coverages that they don't want to cover. And you also are paying for coverages that you don't want. And one example of that is during the time I was a healthcare advocate in Colorado, I was at a luncheon and the lady next to me asked me what I did. And I said I was a free market healthcare advocate. And she said, "Oh, I'm for the free market too, but," she said, "my husband wants to quit his job and we start our own business. But we tried to get health insurance, and I had postpartum depression last year, and we couldn't get mental health insurance for me. If we do this insurance, or if we start this business, we couldn't get mental health for me, and they wouldn't write the policy at all for us." And I said, "Well," and I happened to have learned this. I said, "Well, that's not The insurance company's not doing that to you. That's a government policy.
Mhm.
The government policy is saying all mental health benefits are going to be covered, and you can't exclude mental health benefits. So the insurance company can't pause your insurance and say, we'll write the policy for you except for those benefits for a year or two and then come back. They used to do that, but they can't do that now because the policy says that they have to provide these benefits. And so they couldn't start the business they wanted. Her husband had to continue working. And so her choices were limited.
And these restrictions on both patients and providers would have applied regardless of whether the 208 Commission recommended the universal model or the mandated model, right? Because
Yes. Yes.
even if they went with the mandated model, it's just universal healthcare through some other means, right? So it's the private health insurance that are being regulated in such a way that would achieve the same goal of universal coverage.
Correct. And in fact, there have been some mandates all the way through, but when we're talking about mandated in this context, it's even mandating it on a bigger, larger scale than previously.
And so that also shows what's at stake, not just for patients and providers, but also for private insurers. They're a key player here as well. They were either going to be eliminated or regulated in such a way that they don't get to decide on the products and services that they sell and the value that they provide for others. They would, in effect, become government bureaucrats.
Yes, that's a very good way of putting it.
So now that we have on the table what was at stake for you personally and for other people in Colorado at that time, and now that you had gathered this group of people that were willing to fight this commission and its potential proposals, how exactly did you go about doing it?
Well, the first thing we did was we had one person who went out and found that it's easy to find out how many newspapers there are, and you can get a list of them and through the press office and so he got that list and he circulated it to anybody that wanted to write letters to the editor or to write op-eds or whatever. And over the course of the next year, we had about 11 people, I think, write over 70 letters to the editor in about 15 different newspapers.
And what was the kind of content and arguments that you were producing there?
They were all about a free market in medicine. It depended because if they were letters to the editor, it was in response to some article that was written in the newspaper, and the person would be responding specifically to that issue. It wasn't just writing in on an ad hoc basis without any reference. And so it was very specific to whatever was being written. And at the beginning and throughout most of the time, newspapers largely were in favor of more government involvement in medicine. And so it was easy to find those articles and to respond to those articles.
And so that provided at least some pushback. So people
Right.
are reading the local newspapers, they remember an article from last week about the 208 Commission. They might not know what to think about it. And then there's this letter to the editor that's
Right.
a new edition of the newspaper, and they see that, hey, there's some legitimate questions to be asked about this commission. We shouldn't take it for granted that these are the only options. So it's about creating mental space in the readers by simply speaking up.
And writing in opposition to a specific statement or group of statements that the paper made. So the thing that I did, I went to the first 208 commission, which was all day meeting. It was set up. It had about 24 members, 27 by the end. Some of these members were appointed by the House, the state House. Some were appointed by the state Senate, and some were appointed by the governor through the insurance commissioner. And the election had just occurred, so we had an outgoing Republican governor, we had an incoming Democrat governor, and so they allowed the incoming Democrat governor to also select three people. So we had a lot of people. And the interesting thing to me about this is that there were no profit insurance companies on this board at all. There were doctors, the medical society was represented, the insurance commissioner's office was represented, and there were various nonprofits for various minorities, nonprofits for poor people, nonprofit medical or hospital, and other things. All of these people representing our social care workers, just a whole host of all of these people. But there was nobody that was for, like I said, for the private, no individual patient, no patient representatives, and no profit insurance companies were on the board as well.
That's fascinating.
And the only one free market person at all that was on the board was an economist, a healthcare economist. And she is the one that got me involved in this. I talked with her. She was the one that made the presentation that I went to and was sounding the alert about this. Her name was Linda Gorman, and she and I actually became friends over this. And she joined our coalition, even though she was on the commission. She wrote a couple of letters and a couple of articles as well. But she was the lone wolf on that commission of anybody advocating anything other than more government involvement. Everybody else was in wanting more government involvement.
So now we've gotten a sense of the composition of the commission. Just very briefly, how did the commission even come about?
The legislature decided that something should be done because 20% of the people in Colorado didn't have insurance at the time, health insurance. And they felt that that was a terrible amount. There were a lot of people that were concerned about that at the time, in other states as well. And there had been some states like Massachusetts had what became known as Romney Care, which was mandated insurance care. Hawaii had some sort of a mandated insurance plan as well. And that was kind of the model that was starting to go around the country. And so that was what they were looking at doing, was creating that. And they wanted a commission to figure out what would work for Colorado and suggest that. Then they would come up with a proposal, and then that would be what the legislature would vote on. So the legislature created the commission, charged its duties with coming up with the plan, and then set it in motion.
And Romney Care was the model that eventually also inspired Obamacare, being fought for on the federal level around the same time. This new way of thinking about insurance, not as on the catastrophic model, but to cover all healthcare and not discriminate based on someone's risk to insure them, was in the air in general. And it seems Colorado was just a little bit ahead of other states when it came to that.
Right. And so I attended the meetings and I listened very carefully. There were not very many people at these meetings that
Mm.
were in the audience. Oftentimes, there were maybe only 4 or 5 people. I went to every single meeting, and commissioners would always come down and ask, "Well, who are you?" And at the very first meeting, they came down and asked me after when they would take a break. They were on a stage, we were in some sort of an auditorium, and they came down and I told them my name. I'm Lin Zinser. And they said, "Where are you from?" And I said, "I live in Arvada, Colorado, which is a suburb of Denver." And, "Well, who do you represent?" And I said, "I represent me." I
Mm.
said, "I'm concerned about what you're doing and I'm here." And they didn't know what to do with that because at that time, the first meeting was we hadn't really gotten everything going yet. And I did represent me. So that was very interesting. That they didn't really know what to do with me at all. Later that same day, they read a statement from the Colorado Medical Association that indicated that all of Colorado's doctors were in favor of some sort of a plan. And I texted Paul, who was not there. He was working at his job as a medical doctor. And he and I talked briefly. I don't think we talked during the day. We made arrangements for me to talk in the evening after he got off work. And we talked that evening, and he didn't have any idea he was a member of the Medical Society. So he couldn't attend the second day, but he gave me a statement to read to the commission, which I did. And that really upset the commission and got us off to a really great start because the commission, one of its members was the vice president of the Medical Society, who was there on behalf of the doctors. And he had read the statement as representing the doctors. And Paul said he didn't know anything about the statement. He didn't represent him. It didn't represent any of the doctors he knew. And that really got that particular member, but the whole commission kind of woke up and came out and talked to me. And I texted Paul and said if the commissioner, because he wanted to talk to Paul directly. So I made connections for them to do that. But basically, it was a draft statement that the commissioner was reading, not an adopted statement, which wasn't clarified until after I had had this exchange. And so at that point, they started paying more attention. And that was very eye opening for me to see that you have to really watch what they're saying and doing. And so I then, during every opportunity to ask questions or to make comments, I would do that. Mostly in the beginning, it was asking questions to clarify or what did they mean by this or that. I was very careful never to thank them for their service, never to be indicating that I thought they were anything other than people on a committee that was, you know, out to do a job. I did not think what they were doing was appropriate, so I was not going to thank them. I also was not going to be nasty or mean or abusive to them.
So what's
Which,
interesting about the commission is that, well, first of all, as you already mentioned, was its composition. Certain stakeholders were
yes,
not part of it. Then they have these hearings, which are supposed to get input from the public, where very few people showed up. And when they do, they're not necessarily happy with what they hear. Especially when you point out to them that this message of all doctors support this thing is actually not true because it was a draft. It wasn't actually adopted. So merely by being there, you've already kind of shattered this pretense that the two options on the table, which was universal and mandated coverage, was not at all obvious. And that alone, I think, had a big impact.
it was really eye-opening for me, and I started being much more interested. So I then continued to attend all of the meetings. I missed in November, but I had somebody go in my place at that time so that there was always somebody from us there. And once I had the website up, I told the commissioners about it. And interestingly enough, after several meetings, the commissioners started commenting to me that they were reading our website. They were,
Really?
yes. And it was very interesting. They disagreed, but I became, because I was the only person there for free markets, they would go out and try to talk to communities about what they were doing. They would be invited to come and talk about what they were doing. And a lot of times the communities would then say, well, is there somebody that we could get on the other side of this? And they started asking me to come and speak. And that's how I started speaking. Events was in part because of my being at these meetings and asking questions and disagreeing with them. And so I did. I went around to various town hall meetings and other community meetings, and wasn't a debate. I would just present why I thought this commission was doing the wrong thing and why they shouldn't be there.
It's fascinating. And it's not merely by showing up and disagreeing, but also doing it, as you said, in a respectful way. Because that way they recognize that we need to give some voice to the other side.
And we had, like I said, 70 letters. We had 36 op-eds that were published. I did media appearances. Linda Gorman and I appeared on a TV show together, one of the local TV shows. I did some radio and another TV. And it was throughout the year, it just kept chipping away. They did change in the spring. They dropped the universal health and only went to the mandates because they could tell that they were not getting any traction that way. So we even changed the debate and moved it into mandates.
And you did that by providing a voice against the universal option at the very least, reaching people in the communities who then reached out to their representatives at the state level that they don't support it.
And in the spring, they ask for proposals for various different kinds of reform. And someone who was part of our coalition, but not as free market as I would have liked, but he submitted what he called the FAIR proposal, which was a more free market approach than exists then. And interestingly enough, I think there were 5 or 7 proposals submitted, and that one was struck out almost immediately by the commission. They were not interested in that one at all. But that would never have happened had we not started our effort.
So, how is it that you think you managed to convince representatives at the state level to not support these bills?
It was a slow effort across the state and across the whole year. And part of that was I went around to different communities, but we also had people writing in papers all across the state. And what was really exciting for us was when we would see a letter to the editor that we didn't recognize the signature of. And we started seeing more and more of those popping up. I went and spoke to a group in Colorado Springs, and one of the persons in the back of the room, when I was telling them what they were doing, was a chiropractor, turned out, and he stood up and he said, how do these people think they have the right to do this to us? I mean, that's the kind of response that is very endearing for me to hear. But I think people gain confidence if they hear the right arguments and they're already tilting that way, or they think there's something wrong, but they don't know what's wrong. If they hear it from other people, then they can respond in a positive way. And I think there are a lot of people out there who would respond positively, and they did respond positively to us. You know, not everybody, but it was very interesting to me. I also, because of candidates and various things, I got invited to speak at some Republican meetings that were educating politicians on healthcare. And so I spoke to them and why this bill was wrong and advocating for free markets. And I actually had a lot of people that were out there spreading the word. I don't really know how to say that other than that. It's just that we really did have more of an influence than I ever thought was possible. I didn't think we would win, however, but I knew that we were making the best effort possible. And that was for me the most important thing, that I make my best effort. And in fact, at various times, I talked to a couple of legislators at different meetings, different events that I went to. Even the person who was in charge of the state policy advocacy groups, every state has a free market, or they call them free market, think tank. Every state has at least one. Some states have more than one. And ours was the Independence Institute in Colorado. And at the beginning, even the head of that organization leaned towards forcing people to buy insurance. And he backtracked on that relatively quickly. It really is interesting because I think a lot of people just get tired of fighting, and so they give in to the government pressures. And we weren't going to do that. We were advocating for free markets.
And they recognize that these people are principled. We're an institute that ostensibly are supposed to be for free markets, and they're doing a better job than we are.
And the thing that I found interesting is even people who didn't agree with the free market position recognized that we were being consistent. And we were being consistent in large part because of my core group. I do want to bring this up. We were a core group of people that admired Ayn Rand and her philosophy. And because she advocates acting on principled action, and that principled action is the only way to live your entire life. And that principled action revolves around individual rights in the political sphere. And so that is what was really crucial to us, that we always be consistent in advocating completely getting government out of medicine. People that disagreed with us on the position were still impressed that we were consistent. So that was really heartening. It was a really interesting time for me and for the group itself. The bill itself was interesting to learn about. I knew that they were getting ready to pass the bill. I went and spoke before the legislature, which I'd never done before. And I actually went to see them debate the bill and learned that I could speak. And so I hadn't even known that I could do this. And I decided I needed to get up and speak. So I did. I got up and advocated, made a very short ad hoc 2-minute talk, and then learned that that bill had failed. And then it went into committee hearings, and I was pretty sure that it was going to fail. But it was interesting because the day after it had passed, and I went to a meeting at the Free Market Coalition, where I'd been going to meetings, partly to just keep my hand in and know where I might need to go speak or what I might need to do. And they met monthly. And so I went to that organization's coalition meeting. And at that, the senator came up to me and he said, Lynn, I need to tell you about this bill. I know you thought that I voted against it, which I did, but I had to vote against it to get it pushed back so that we could get it amended to change it, to get it, and then we defeated it. And so it didn't pass. And I wanted to win. I hoped we could, but I was really kind of surprised that we did. The interesting thing for me from this aspect was it was a very loose coalition. Nobody had any responsibilities that they didn't want to take on. Everybody did what they wanted to do. We had some people who did more than others. We had some people that did very little, but everybody was appreciated. Every effort was appreciated. And Paul, it kind of took on a second life, and he ended up continuing to publish and went on to publish in Forbes and other magazines for a number of years and kept the website alive until just recently, about a year ago. And he deserves a lot of credit for doing all of the immense amount of writing and keeping the website alive. And the other people that were involved in it deserve a lot of credit. I mean, I started it. That's what I feel like I take credit for as I started this effort. But I could not have done it without the great people that jumped in with me and without the ideas. One of the other things we did was Leonard Peikoff wrote an excellent article called Healthcare is Not a Right about Hillary Care. And this was a really good article. And I wanted to get it published and use it for our effort. And because it referred to Hillary Care, I wanted to update it. And so I wrote to him or called him and asked him, and he agreed to let me update it. And I made the changes. And then he said, well, you have to put your name on it too, because now you've done part of this, which I didn't expect and I didn't know. But so that article is on our website, the updated one, and it's still the one that's in use today because it talked about universal health care. And that's really what Dr. Peikoff was talking about, but he was using the familiar acronym at the time of Hillary Care.
It's the version that we currently have on our website.
Yes, right. And I think that's where I saw it was on AFCAM's website initially. I think that's the essence of what we did and how we did it.
So looking back, why do you think you were able to be successful, and what practical advice would you give someone who might be interested in health policy advocacy on the state level?
There are three or four things that I think are important. One is for every person involved, it was a personal issue. It was really something very personal and selfish that they wanted to address. And that certainly was true for me. And that gave me the impetus to keep going all through. The second thing that I think about is we were very principled and we did not waver off of that. And I think that's really important that you need to be as principled as you can make the arguments. A third thing is it was wide but narrow in scope as well. And I mean that in terms of time. We had an 18-month deadline essentially. And I think that really helps because if you look at so many things that we think about, we want to change the IRS code, we want to do this, we want to do that. I mean, we want to do away with Medicare. Let's just talk about that. We want to do away with Medicare. We want to do away with Medicaid. We want to do away with these huge government programs. Those are immense programs, and they're not easy to get rid of because so many people are dependent on them now, including me. That's now my healthcare provider. And so the point being that having a deadline made it manageable, that I only have to do this for a certain period of time. And then I can either recommit if I want to continue to do more, or I can back off and go and do something else for a while. And I think that's really important. If we can find specific projects to work on, and obviously with Medicare, it's going to be some limitation on that or some aspect of that, for example. Now, I'm not even suggesting we do that, but I think that's really important.
Sure.
And I think you need allies. You have to have people that you really trust have your back and that are with you on everything that you want to do. That's where AFCAM, or in my case, we did that because it was state level, and AFCAM is much more bigger picture. I mean, it could include all 50 state level programs, but it's much more. But because of that, I really needed people in Colorado that were with me on that. And I think that allies in my state that were really excellent. Everybody was a wonderful person, and everybody did as much or as little as they wanted to do.
So what would you say to someone who is intrigued in doing something similar to what you did, Len, and advocating for or against certain health policy changes on the state level, but they are concerned that it's a waste of time, or perhaps they're afraid, right? Like, what are people going to think? They're going to think that what I'm advocating for is morally wrong. What would you say to them?
I would say talk to Ray Schur at AFCAM. It's one of the things I'd say. I would look for people in my state that I could work with on something. Because even issues that AFCAM deals with, a lot of the issues are at the state level, not at the federal level. I think you have to figure out what it is you think you could do and then start talking to people about how to do it. I mean, that's what I did. I gathered people around me that I thought might be helpful or that would be interested or whatever. They were encouraging. I'm tempted to say, and call me, but I don't. And I'd be happy to work with you on helping to do that.
One thing I find inspiring about your story is that you went into this not expecting to win, in fact, expecting to lose, but you did it anyway. Now, it ended up being the case that you won, but why would you go into this not expecting to win?
Because it did feel like, how can you fight the system, right? I mean, it's a big system. But what I learned, I think pretty early, this is the thing I think, it might have come out differently, but pretty early I could see cracks in the system, like at the commission level. And I think that's part of the other thing. I don't know whether I said this or not, is to start at the beginning, to try to find the beginning of where the commission, the investigation, or before it's already taken shape and it's already on the way to the legislature. Try to find that. And I think you can do that. And maybe one way is to even go to the state free market think tank people and see what they're doing, because they'll probably have some ideas. But maybe, like me, you just hear about it and you think, what can I do? I want to go to this meeting. That's what I first went to, a meeting to hear about it. So I don't even remember how I found out about the initial meeting where Linda Gorman was talking about this. I think we could make more of a difference than we think we can.
That's right. I think what your story shows us is that when it seems impossible, but you actually look into it, what you're up against is not as firm as what it looks like. And also, even when it might be firm and daunting, by fighting against it, you're still fighting for your values.
Exactly. And they're not fighting for anything except the status quo. And so there's something about that, I think, that is thrilling from my perspective.
And empowering.
I'm actually fighting for something, and they're just not.
So, with that, Lynn, thank you for sharing your story, which I hope will be inspiring for other people to tell their own story of how they got involved in healthcare policy advocacy. Thank you.
Thank you very much for having me. And I would encourage anybody to do it. If I can do it, anybody can do it.
To stay up to date on our newest episodes, subscribe to our show from whatever podcast platform you are listening from. To support our show and Americans for Free Choice in Medicine, you can make a financial contribution at www.afcm.org/donate. Thank you for listening.